thank everybody for coming.
Kevin, just give me 1 sec before you start. No. This is great, I could go home. I'm Gary, and I just want first to thank you all for coming. Secondly, anyone with a cell phone, please put it on vibrate or mute. I shouldn't say anyone with a cell phone, I'm sure everybody has a cell phone. Afterwards, Steve and Diane, the owners, want to say thank you for coming. I hope you enjoy the presentation. And everything in the store, except for prescriptions, is 20% off, and we'll be around afterwards. If you have questions during the presentation, feel free to pepper Kevin with questions. But also, we will be around afterwards, and so you can ask questions afterwards. So Kevin's a registered pharmacist at Johnson's. He works in the men's health department, as well as he has other special areas throughout the pharmacy. He's a graduate of the University of Rhode Island in 2013 with a Doctor of Pharmacy. He's a member of the Mass Independent Pharmacists Association and the International Academy of Compounding Pharmacists. He works directly with patients and providers to develop compounded medications to treat ailments when commercially manufactured medicines aren't available. He also is an avid runner, and during that real cold snap, he was out before work running, freezing. He probably had frost built up on his eyebrows, so we're not too sure mentally some days how he is if he does that. And we look forward to his upcoming wedding this April to his lovely fiancée, Sarah. And with that, I turn it over to Kevin.
Alrighty, well thank you very much, Gary, for the introduction, and thank you to everybody for coming. Today I'd like to discuss many things involving health and wellness for men, and number one, it's really not just about male patients, because a lot of things that I'm going to talk about certainly incorporate women and women's health, and our general health and wellness can prevent a lot of health concerns that people see in early, middle, or later in life. I don't have any conflicts of interests. Nobody's paying me anything. Let's see. And as Gary said, I do encourage questions if you are uncomfortable about asking anything, because some of the topics are sensitive and related to reproductive systems. I understand if you don't want to ask something in public, and please ask me privately. I'll also give out my business card at the end with my email address and phone number. You can call me or email me if you have any other questions, if you want to ask in a more discreet way. All right. The objectives of this presentation are to define what men's health means. I want to explain some of the pathways that lead to erectile dysfunction, as well as certain men's health illnesses that we often suffer from, whether from general health-wise or from just the reproductive system. I want to talk about prescription as well as OTC treatment options, because depending on your case, depends on what kind of things might help you in the long run. And most importantly, as it is, I do want to discuss lifestyle modifications that can have a greater impact, in my opinion, than a lot of these medication options, because maintaining our health is going to cure the underlying problems that lead to disease. Okay, now this is how I feel that every man wants to be very masculine, such as the lumberjack with the large beard, or the bodybuilder type who ironically has no hair. But this kind of lifestyle takes a lot of work to maintain and to get there. And if we don't take all the right steps along the way, is where sometimes you find yourself at the doctor and you might look like this. So I want to talk about everything that might prevent something like this from happening. And even if you do find yourself in this position, there's certainly a lot that can be done once you're already here. So what is men's health? A literal term will relate any ailment or health-related concern that's exclusively for men, but a more targeted term does relate to male sexual health. So patients that have loss of libido, erectile dysfunction, premature ejaculation, as well as heart health concerns are some of the more targeted realms that doctors and prescribers work with their male patients. A term specifically related to men's health is also known as andrology. It is the antithesis of gynecology, where you think gynecology specifically would be the practice of alleviating women's health concerns. That's where you see andrology as a specific medical field that you see mostly urologists and prescribers that want to specialize in men's health will study. Let's see. So some of the pathways that will impact male sexual function, there are a number of pathways that will. Most notably for men is low testosterone or low T. There is a standard range of blood levels of testosterone in our body between, give or take, about 300 to 1100 nanograms per deciliter. That's a blood level of testosterone. An optimal range is around 800 nanograms per deciliter, but an average range over a man's lifetime is about 680 nanograms per deciliter. So when you're a teenager, you're going to be at those peak levels around 1100, and as you age from your teenage years, your testosterone levels will decline. That is a normal aging process. But as we've heard from other doctors in this lecture series, just because your testosterone levels decline doesn't mean that you can't supplement them to maintain your lifestyle, and that's a big thought in the anti-aging world of medicine. And as I wrote, the levels decrease about 1% per year. So, as you age, your levels decrease more when you're younger, and they will decrease slower as you're older for men in their 70s and 80s. But by that point, if you haven't supplemented or if you haven't done what it takes to fight that anti-aging, to fight your natural aging process, then those levels have been depleted. So there are a number of impacts that testosterone has on the human body. This is just a highlight of the most common men's health-related testosterone effects. So testosterone maintains bone density, regulates fat distribution, as well as regulates and maintains muscle mass and strength. This hormone also will regulate facial hair and body hair. That's why you see teenagers start to develop facial hair. It goes hand in hand with a spike in testosterone during their adolescence. The hormone also impacts the production of red blood cells, as well as it is required for sperm production, and not listed, but is also very important in libido as well. So this is just a simple chart discussing some of these most important effects of testosterone, and on the right you can see, more importantly for patients that I might see or patients that doctors might see, who they're treating if the patient suffers from the effects of low testosterone. It's not a linear curve. You can't pinpoint your testosterone level and your age and say, these are what my symptoms should be. Every patient presents in a unique way, so it's important to note that prescribers will measure a patient's testosterone level and use that information in conjunction with their body's signs and symptoms to create an action plan going forward. But most notably, in terms of men's health and reproduction would be the decreased libido as well as a decreased amount of sperm production. But is testosterone always the answer in men? As I said, everybody presents in a unique way, and there are a lot of factors. So testosterone decrease or low T will often be seen in patients that are older, but it'll often present in patients that are younger that haven't necessarily maintained their weight and physical attributes the way that they should or could. So That's where you see some of the physical factors that affect your overall health. Nervous system has a big impact in terms of your sexual health. For example, every single cell and muscle is innervated by a nervous cell. So whenever you want to make a muscle, there are millions of nerves that just work to move my muscle, my bicep. And it works the same way for men that want to and need to create and maintain an erection to be with their partner. There's also a large emotional level of being ready and willing to want to be with a partner. Patients that have depressive symptoms or even if they're on antidepressants, certain side effects of those medications as well as their overall depressive mood can have a large impact on their performance. And again, I do want to discuss a few more of the comorbidities that can have a big effect on your performance as well and your erectile function. So number one would be atherosclerosis, and this is a loss of elasticity in the arteries. Your arteries can become brittle instead of, it's similar to the way that an old rubber band may look compared to a new rubber band. And if you see an old one, the old rubber band cracks, it can break even. You see the same thing with blood vessels that aren't as healthy as they could be. Somebody that maintains an active lifestyle is constantly working their blood vessels. When you are, say, running, like that's an example I'm going to use a lot. When you're running, your blood is pumping much harder than it usually is. So your blood vessels are constantly contracting and expanding to deal with the different amount of blood flow that they're using at the time. And while your blood pressure and your heart rate is increased for that time you're exercising, it's actually beneficial for your blood vessels because it can allow them to not only regenerate themselves, but increase their lifespan and quality of their lifespan. Number two, a big factor in development of atherosclerosis is increased cholesterol in the body. So cholesterol, I do have, this would be an example of cholesterol building up and causing a narrowing of an artery, that when you have that extra restriction in the blood vessel, your heart has to pump harder and with a higher beat and with more contractile force to get the same amount of blood to that part of the body through the blood vessel. So over time, the body can handle this sort of plaque, but over time, if it's put in the wrong, if it stays and if it grows and if it becomes firm and if it's in the wrong blood vessel, like a coronary artery surrounding your heart, that's where people have heart attacks. And unfortunately, when something like that happens, there's a high rate of death, unfortunately, but even so, the kind of steps that have to be taken after a heart attack can have a big impact on male sexual function. And again, I can't talk about atherosclerosis without talking about heart disease. So there are two types of heart disease that both have a big impact on blood flow in the body. And number one would be systolic heart failure. And when I talk about heart disease, I'm specifically talking about the left ventricle in the heart. It is by far the most important chamber of the four chambers of our heart. The left ventricle pumps blood through the aorta that's oxygenated, and then once it goes through the aorta, it goes to the rest of the body. And patients that have systolic heart failure often present in a similar way, where they may be overweight and they have increased cholesterol, and because there is increased resistance to pushing that blood through the rest of the body, the heart can fall behind in its workload. And what happens to that left ventricle is that it will become enlarged, and it will actually look bloated in a way, that the heart, if it was meant to, if the ventricle was meant to pump like this, somebody with systolic heart failure, the heart will only be able to pump part of the way, and you'll see lack of blood flow and impaired performance because the heart's not pumping as effectively as it could. Diastolic heart failure is completely different. It's the complete opposite, but it's the same end result, where the body does not pump enough blood to the rest of the body from the heart. What happens in diastolic heart failure is that the vessel walls of the heart actually become thickened, so the heart becomes more muscular than it should be. And what happens, instead of the heart growing larger like systolic heart failure patients, the heart stays the same size, the ventricles actually become smaller. So the body's ventricles are able to pump all the way that the heart was when it was completely healthy, but each time the ventricle pumps, it would be able to only pump, say, 70 or 60% of the blood volume that it used to. So that's exactly why patients with that kind of heart failure have decreased blood flow that can impair performance. Just number one, just a question. Does everybody know what I mean by decreased blood flow and impaired performance? Does everybody want me to explain that real quick?
Yeah, explain.
Okay, explain it. Okay, so patients that, so to create an erection, your body needs to open up its blood vessels in the penile region. And what happens when your blood vessels open up or dilate, that allows blood to enter the penis, and once the penis is engorged or full with blood is where male patients can obtain an erection. And depending on the quality of their vasculature or their blood vessels, allows them to maintain their erection for the amount of time necessary for them. And again, a significant contributor that increases the risk of patients having erectile dysfunction or erectile problems is diabetes. Patients that have diabetes suffer first from an increased amount of blood glucose in their blood vessels, and blood glucose is especially damaging to many of the organ systems in our body. So glucose, while it's such a small molecule, is very damaging directly to breaking down tissue. So that's where you see a lot of problems, especially with patients with atherosclerosis. Patients will, their blood vessels have an easier chance of breaking or bleeding out, and that's where patients might have internal bleeds. Most of them are minor, but patients can have bleeds on the skin, notable on the skin, especially on very small, fragile capillaries. The blood vessels will also, glucose will also damage the blood vessels in the kidney. That's why patients will often have kidney damage or impaired kidney function, as well as impaired blood vessels in their eyes. That's where patients with diabetes often can develop blindness. Patients with diabetes have the highest rate of blindness in this country. And so and especially with patients with diabetes, they often present with an increased amount of gut fat or belly fat, and these sort of patients often will suffer from the same sort of heart failure and hypertension that you see with patients that just have hypercholesterolemia or patients with hypertension alone.
Excuse me.
Yes.
Is diabetes ever reversible?
Yes, absolutely, and that was part of my discussion as well.
Oh, good.
So somebody that has diabetes has, most notably, besides an increased amount of blood glucose, has an average amount of glucose measurement called an A1C. So somebody that has diabetes traditionally has an A1C level above 7. And somebody that doesn't have diabetes traditionally has a level somewhere between 4 and 6. But somebody that has diabetes clinically wants to be at a goal or below an A1C of 7. But I do want to stress there are 2 types of diabetes. There's type 1 as well as type 2. Type 1 is a patient that doesn't produce insulin anymore. The most common reason is patients that have had some sort of infection. They were born with some sort of congenital defect that leaves their pancreas unable to produce insulin anymore. So that sort of patient is always going to have diabetes because they're never going to be able to produce insulin anymore. That patient is always going to require insulin therapy as a result. But somebody with type 2 diabetes is by far the most common patient. So somebody that, because of overall lifestyle, some of their, not necessarily choices, but just changes over time, the patient will present with a lot of these symptoms: an increased blood pressure, their heart may have some sort of heart failure, more likely to be systolic, and they'll have hypertension traditionally as well. But most notably is the increased amount of blood glucose. And if there are a lot of things that can be done, and I will discuss that a little bit later too, but there are a lot of things that can be done for that patient. And someone with type 2 diabetes doesn't have to have diabetes eventually if they do a lot of things right.
Kevin?
Yes.
Is it possible to have a 0 A1C, or would that be desirable?
It is not desirable. So we need glucose. We just can't have too much of it. So our body needs sugar to be able to run a lot of our metabolic processes. So we need to be able to have energy. Ironically, we don't have to eat any glucose, or we don't have to eat any sugar or carbohydrates. Our body can actually make carbohydrates on its own. Our bodies really only need to take in protein and fat, but I guess you could say old habits die hard, and the average American diet is rife with carbohydrates, and it's almost impossible to get rid of them, but we don't actually need to take in carbohydrates. There's a process called gluconeogenesis where our bodies will actually break down fat to create glucose. And that's the paramount reason why something like the Atkins diet is a fad diet traditionally, but if somebody will stick with it long enough, they'll actually lose a lot of weight because their body, they can see the benefits of their body, not taking in any carbohydrates. Does that make sense? Okay.
You hit the top button on the control on the hand. There you go.
Okay. That's good. Okay. Okay. Sorry, guys. I can just do it from here.
Sorry about that. Technology at its finest.
I hit the wrong button. He's being honest.
Now he's gonna go over and get rid of that. Back here.
Okay, so depression can have a large impact on male performance and erectile function as well. Number one, because of psychological factors. If somebody doesn't have the energy or the will to want to be with their partner, then erectile function has a lot to do with psychological factors as well as just the touch and feel or being in the moment. So that has a huge impact in function, and you don't have to have major depressive disorder to be able to suffer this. I mean, I think if anybody has ever been at a point where they're not in the mood, then things don't necessarily happen. And this is normal. I mean, this is part of our lives time to time, and it's always something to make sure that your partner can understand that. But it can also, patients that have depression can also attribute some of their erectile function issues to side effects of certain medications. Now, certain antidepressant medications do cause anorgasmia for men, so that means that they're not able to have an orgasm, and it doesn't hurt their erectile function, but this may impact a man's will to want to be with their partner because of that certain medication. My recommendation is to evaluate with your provider what antidepressant type of medication you're on, and use that to look at other options that are out there. So common medication that doesn't have any sort of sexual side effect is bupropion, or it's also known as Zyban or Wellbutrin. And that's an excellent choice for somebody that still wants to maintain an active and healthy sexual life with their partner. Just another point as well, there are also certain medications out there like Seroquel, and so that's a class of drugs known as antipsychotic medications, but they're not just for psychiatric patients. They're also used as sedative orders for patients as well. But certain items like this can actually cause weight gain and metabolic syndrome that we see in patients with diabetes. So not only do you see increased blood glucose as well as increased weight gain and hypertension with these patients, if they have any type of psychiatric need to be on this medication, it can certainly hamper or affect their performance. There's a certain procedure for patients that have had prostate cancer, or patients that have had BPH, or benign prostatic hyperplasia, also known as an enlarged prostate. It's called a radical prostatectomy. This is a surgery done by urologists to essentially remove your prostate, and it is often a life-saving procedure, but in terms of affecting male erectile performance, unfortunately can have a devastating lifelong after effect. This type of procedure will damage the nerves and the blood vessels just before the penis and above, just after the bladder anatomically. So unfortunately for male patients, while it is a life-saving procedure, it does have a number of negative effects in this realm after they perform the procedure. Now, a very rare syndrome that patients may have that can affect their male performance is called Peyronie's disease. This is a disorder where men develop a curvature in their penis because of development of scar tissue just below the skin. And what happens is, while the curvature is created, or there's an hourglass formation, depending on the patient, patients will often find that they lose their erectile ability because the scar tissue formation actually has a constricting effect on their blood vessels and can cut off some of their nerves as well to prevent erections from being able to occur in these patients. So it's very difficult for these patients, but again, there are some options that we have for them as well. Another sort of disorder that is a common side effect of medication. Does not affect patient erectile function, but certainly can affect their performance. Patients that have retrograde ejaculation, their semen will actually travel backwards instead of forwards, so back the tube instead of forward in the tube. And this is because of certain medications used to treat BPH or enlarged prostate. And again, while these patients often need this medication to prevent the prostate from cutting off the urethra, it can have these side effects. And of course, it's just important for men to know that this is certainly a common side effect. Most common drugs out there are Flomax, for instance, as well as finasteride. And those are the alpha blockers, exactly. And again, as I mentioned earlier, poor lifestyle choices can have a massive impact on male performance. So alcohol use, men will notice that this effect on blood pressure is negative. It has an effect on our liver. It damages your liver. Your liver will eventually become fatty and can increase cholesterol. The bad cholesterol can lower the good cholesterol, as well as smoking. Smoking will also have poor effects on cholesterol, like lowering the good cholesterol in our bodies, as well as increasing the chance of developing hypertension. Now, of course, these are excellent options for lifestyle changes because everything in moderation for alcohol. You don't have, the recommendations for women in this country are 7 alcoholic drinks per week, so about 1 a day. And the average limitation recommendations for men are 14 drinks per week, or about 2 per day. So somebody that binge drinks, so women that have 4 or more drinks at one time, or men that have 5 or more drinks at one time, will increase their risk of developing fatty liver disease or liver cirrhosis, which is further damage of the liver and affecting their performance. Smoking as well, tobacco is addicting, so it's very difficult to quit. It often will take people 6 or 7 attempts to quit smoking, but the health effects are very beneficial. Not only can they improve the health of your blood vessels and reduce your rate of hypertension, but can also help reduce the risk of heart disease, and your risk of lung cancer can be lowered significantly when you look at a long-term chart. So patients that were smokers and quit and have been tobacco-free for 10 years have essentially negated any risks that they've created by being a smoker. So there's certainly benefits to quitting no matter what age you are.
Kevin, would chewing
Yes.
tobacco fit in with smoking too?
Yes. It is not as damaging to blood vessels as smoking. So I actually have a friend of mine from college here. But one good example that we had in a lecture one time was, anytime you light something on fire and then inhale it, it's probably not good for your body. Remember that? But so essentially, smoke is hot and it has particulates, and the heat and particulates will really break down any kind of tissue that they hit. So that's why you see smoking having a large effect on your blood vasculature. Tobacco smoking is the most common culprit because the addictive nature of it is so strong. Most active smokers can't go more than about 2 hours without having to re-up their nicotine levels. And the best and quickest way to do it is having a cigarette. But chewing tobacco doesn't have all of the same health risks, but it has its own unique set of health risks as well. So while tobacco smoke increases your chance of lung cancer, chewing tobacco will increase your risk of mouth and throat cancer. So it really is important for all tobacco use. I know vaping and e-cigarette use is on the rise in this country, and it's not smoke per se, but and it is much healthier than smoking, but nicotine alone does increase your blood pressure, so even something like that can impact your male performance. Because a lot of these things for men are all about improving blood flow in our body. If you've ever seen a Viagra commercial, or a Cialis commercial, they will often highlight is your problem a question of blood flow, and that's exactly why, because improving blood flow in the body is the paramount male solution to erectile dysfunction. Yes?
How toxic is vaping marijuana?
I don't have a clear answer on that, but in general, vaping something is going to be safer than smoking it.
But does vaping lead to pneumonia? Does it do other bad stuff to your lungs, or is it not as?
So my answer to that is
But
if you're using a device, you'd want to keep it clean, of course.
Right.
Pneumonia is an infection, so you know that anytime you're not cleaning whatever you're using, whether I don't want to get into the nitty gritty on this, but
I know
think overall
people who
it's-
smoke marijuana who say it's not so bad. I use a vaporizer. It's like I don't smell it, which is good,
yeah.
but I don't know. Or is this not something that's been studied very much?
I guess you could say the jury's still out, but it is definitely safer to our bodies than directly smoking something.
Okay.
Okay. Yes?
You mentioned alcohol. I don't drink, but you said 2 drinks for a male. What size are we talking about?
So we're talking about a 1.5 ounce shot
Oh,
of liquor, we're talking about a 5 ounce glass of wine, or a 12 ounce glass of beer.
oh, okay.
So that's a standard drink in America.
Okay.
I know you go to Ireland, it's like a 22. But those are the standard numbers, or some equivalent of that. So of course, if you have 1 shot of vodka in a mixed drink of soda, that's 1 drink. Okay. Let's see. So diet as well is a big area where improvement can occur for patients, as well as exercise, and I'm going to go into those a little bit more next. Okay. Just part of my self-help and OTC options. So first, I'm just going to discuss exercise. As Gary said, I am an avid runner. I do run about 5 or 6 days a week. I don't expect everybody to do that sort of exercise regimen, but I just want to highlight a little bit of activity recommendations from the American Heart Association and the American Diabetes Association. So it is very cliche. Every time you go to the doctor says you need to exercise. Not necessarily you need to exercise more, but you need to maintain a level of being active. And the intensity of your exercise will impact whether or not you improve a condition if you are looking to improve. So a good example, if somebody told me about, was telling me jokes about, the women that do water aerobics at the gym, they've been going for 20 years, and they were fat 20 years ago and they're still fat now. And the intensity does have a big impact. And another example, I go to the gym in Waltham at Workout World, and I see a lot of people, they drive to the gym to go walk on the treadmill. So yes, it's good they're doing something instead of nothing, but if you are looking to rid yourself of a diagnosis or a disorder, then your impact needs to be based on certain guidelines and recommendations, and not just doing something instead of nothing. So the American Heart Association recommendations for cardiovascular health for patients are to engage in 30 minutes of moderate to intensity aerobic exercise, and that recommendation is for people to do at least 5 days a week, and that is for patients that have some sort of hypertension or heart disease, but it is absolutely a recommendation for anybody that doesn't have those sorts of disorders as well. And there is an augmentation to that as well, that if you are going to perform rigorous exercise instead of moderate intensity exercise, you only have to do 25 minutes of that exercise 3 days a week. So if you do want to get more bang for your buck, doing the rigorous exercise will require less time in the gym. And yes,
Where does jump rope fit into that?
I would consider jump rope as, it is fairly vigorous, to be honest with you. It's very active. If you can jump rope for 25 minutes straight, I'll give you that for vigorous. So, you do it for 25?
I know a fellow that does it for like an hour at a time. It's just, wow.
Yeah, no, it's doesn't look like it, but it is incredible for you.
Yeah.
Absolutely. Or running, I would say as well, for vigorous.
Mhm.
Things that are less vigorous, or I would consider moderate, would be using the elliptical or using a bike or the rowing machine. So there's going to be a little bit less intensity in those exercises. Yes, Omar?
So for somebody who doesn't exercise at the moment, if you were to recommend for them how to get started,
You
what would
absolutely
be your
have.
recommendation?
Okay, so you absolutely have to start somewhere.
Yeah.
The beauty of the beauty and the beast of cardiovascular exercise, it's the easiest thing to gain stamina, but it's the easiest thing to lose stamina as well. So if you were going, if you wanted to then, start going to the gym, and if you were able to run or bike or use the elliptical for say 5 minutes to start, that's excellent. And you're going somewhere in the right direction. And if you notice that every day, if you're able to tack on maybe 1 minute or 1 or 2 minutes, you'll notice that your body should be able to handle that. And if it can't, I totally understand that you have to back off and be realistic with your expectations. But consistency is most important with aerobic exercise, because you need to constantly do it to keep up your level of fitness. The American Heart Association also has recommendations for muscle strengthening exercises as well. Their recommendation is to engage in about 30 minutes of muscle strengthening exercise 2 times a week. And for somebody that is a bodybuilder, that's not a problem for them. But I would recommend the same thing that Omar asked about. You have to start somewhere. If you start with using a few of the machines at the gym and maybe do 3 exercises that day, and if you don't traditionally lift a lot, you're probably going to be pretty sore the next day. But I would say that the day after that would be excellent to try and do those same 3 machines again and see how you feel the day after. And my hope is you're going to be sore again, because that means that your body's getting somewhere. But again, you have to start somewhere, and not necessarily increase the amount of exercises you do, but certainly improve the quality. And you don't have to be bench pressing 400 pounds. If you're doing something where you know that you're getting the exercise out of it, then you're definitely going in the right direction. And again, those are recommendations for overall cardiovascular health. Yep.
Is it possible to exercise too strong? A friend of mine said that the people that do ultra marathons, I guess like 50 miles, 100
Yeah.
miles, that can actually be deleterious to the heart. Is that correct?
So you need to know your body's limitations, and being a marathon runner myself, I think those ultra marathoners are crazy. So they just need to know what their limitations are. So if somebody can go out and do 30 miles of jogging that's their daily workout, if they can keep getting up and doing that every day, then, you know, they should be monitoring their own health. But I think that's great if that's what they want to do. And especially, you know, we were talking about biking earlier, you know, certain serious bikers will bike, you know, 2-3 hours every day. So, you know, as long as you know your body's limitations and are able to respond, and also very importantly, you know, knowing when you can't exercise. If you are hurt or injured, it's very poor for you to ignore an injury and keep exercising, just because you know there are guidelines and recommendations that say that you should. So getting well is, part of it is knowing when not to do every single thing out there. So different than the overall cardiovascular health recommendations, the American Heart Association also has specific recommendations just to lower blood pressure and cholesterol, and the recommendations are all similar, but those recommendations are 40 minutes of moderate to vigorous exercise 3 to 4 times a week. Yes.
So just to touch on something that he was saying,
Okay.
have you ever heard of an athletic heart?
Yes.
And is that something that you were talking about personal limitations, or like someone who does that kind of extreme exercising?
So when you mean athletic heart, somebody that is
Like
in
a
very good shape.
thickening
Yep.
of a
Diastolic
heart.
heart failure.
Yeah.
Yep.
Just like someone young,
Mhm.
that had been aggressively exercising, and there was a possibility of having an athletic heart
Absolutely.
due to exercise.
And that's absolutely possible.
Is that just like a personal thing for that person, or is that something, a generalization for someone that does vigorous exercise? Like,
It depends on the it depends on the type of exercise. So somebody that is somebody that's a big weightlifter, for example, has more of a risk of creating diastolic heart failure. And is that what you were touching upon, like the thickening of the heart?
Yeah.
So somebody that is a heavy lifter rather than somebody that focuses on aerobic exercise has an increased chance of diastolic heart failure. It's also seen in somebody that abuses drugs to be able to strength condition. So somebody that abuses testosterone for athletic benefits is at risk to use this, because if that person doesn't need testosterone supplementation and they are supplementing themselves, they do have an increased risk of developing this. That's why you do hear certain, excellent athletes that die of heart attacks at 40 years old, because this does happen to them in certain situations.
But it's not typically correlated with like aerobic, it's more like strength training?
Correct. But not necessarily, it doesn't make strength training bad, it's still very good for you. Again, everything in moderation. Yes.
Yeah, prior to a couple of years ago, I mean 74 in the summer, the fall of 2013,
Okay.
prior to that, I was diagnosed with 5 aneurysms.
Okay.
And prior to that time, I was working out twice a day,
Okay.
one spinning and one another exercise. And was getting some very good return on investment.
Mm-hmm.
But since I've been on this, since 2.5 years ago, 2 operations, the whole strength level was down.
Mm-hmm.
And I've been exercising maybe once every 2 days
Okay.
with not the return on investment, so
Okay.
it was a little strained. So there was a major difference that I was experiencing of prior to the aneurysms. And I'm part of a study of 142 people,
Mm-hmm.
and today was one of my follow-ups.
Mm-hmm.
And they were saying that once every 2 days is good.
Mm-hmm.
It's not what I enjoy the most, it's a treadmill,
Mm-hmm.
but I can't do spinning the same way. I just can't do that. So
Like
they-
you don't enjoy it, or
Well,
you're
I-
just not able to?
I'm not getting, I enjoyed it a whole lot sociologically as well as physically,
Okay.
and getting some very good returns on it. But now with my exercise on the treadmill, it's just not the same. And they said that's okay, being older, that once every 2 days is still good.
Yeah, and again, everybody is unique, and I don't wanna call you a case, but every case presents itself in a unique way. So, based on your situation, if your doctor has, decided that 2 days or every other day is adequate for you, then I don't wanna go against those recommendations. These recommendations are generalized and not taking into account every factor that could be possible.
A lot of it is listening to my body. And,
Absolutely, not overdoing it and, yeah. Resting, the Rice method. So rest, ice, compression, and elevation when you snore is excellent. Well, good. Let's see, so just some quick other recommendations from the American Diabetes Association. Their recommendations to help patients lower their blood glucose and to lower their A1C or their average blood glucose is to recommend that patients will participate in high levels of physical activity, which I attribute to being more aerobic exercise. The American Diabetes Association recommendation is to exercise between 200 and 300 minutes per week. So you can factor that into about 30 to 45 minutes per day. And for patients that have diabetes, it's more important that their activity is continuous, because as you're continuously exercising in an aerobic fashion, biking on the elliptical or running or swimming, your body is draining out the blood glucose and using the blood glucose in your blood, and then what it's doing when it's done with that extra blood glucose you have, what it can do is it will pull the fat cells in your body and will break down the fat and make glucose out of that, and that's traditionally how people lose weight when they exercise. So the fat is converted to something else. Traditionally to water, just water vapor, to be honest with you. You breathe fat right out of your mouth when it breaks down, but when fat breaks down to become glucose in another way, that's how somebody with diabetes or elevated blood glucose can normalize their glucose levels. Are there any questions on that?
Does exercise impact our testosterone?
Absolutely. It is a natural way to, it's based on feedback mechanisms. So like any other hormone, testosterone is a hormone that our body will secrete as needed throughout the day. And it traditionally comes from the testicles. So when our bodies break down muscle, as we do when we exercise in an aerobic fashion or we weightlift, that sends the signal to the testosterone producing area of our body in the testicles to then secrete out more testosterone. So by that feedback mechanism, our body's blood testosterone levels will increase.
Cool.
Okay, so portion control for patients when eating is very important as well. It's not exercising enough, as well as a poor diet or too much of a good diet will impact our BMI or our weight. So somebody that has plenty of blood glucose in their blood but is still eating those potato chips is just feeding more glucose into our bloodstream. And what happens to that glucose, for someone that's not diabetic, insulin comes out of the pancreas into the bloodstream and attaches to that glucose, brings it into our cells, and the body says, I don't need this, I'm going to make fat with it to store it. That's how our bodies are built. It's an evolutionary trait that we have for survival, just in case something happens. But in this day and age of food everywhere, it's more of a hinder than it is a help for us. So portion control using smaller, more frequent meals will prevent people from being hungry throughout the day. Back when my parents were children, recommendations were to have 3 big square meals a day. That worked well for a long time, but again, in this day and age, there's been more research to find that smaller meals will actually maintain patients' blood glucose levels throughout the day more effectively. And having some food in our body throughout the day more often rather than overloading it with massive meals 3 times a day will actually keep us fuller for longer, depending on what you eat. Because the feeling of fullness versus hunger is not about how much fat we have on your body. I mean, it's about how empty or full our stomachs are, and you have that pitting feeling if you've digested all the food that you have. And because of those factors that I discussed, that's where carbohydrates have such a large impact in fat creation. Not only do they get taken up by the cells to be made into fat, but carbohydrates are the easiest products to break down in our stomach. Fat takes the longest to break down, followed by protein, and then carbohydrates by far is the quickest. So if you think you eat a big bagel in the morning, and it's not unheard of to be pretty hungry an hour after you eat that bagel, even though it looked like a good amount of food, and even though you felt pretty full after eating it, because it does expand in our stomach and make us feel fuller for that time, but then it quickly breaks down and we're hungry by 10 a.m. So let's see, so just a few lifestyle modifications that do help to increase testosterone in the body. So an adequate night of sleep. Like other hormones, testosterone does follow in a cyclic 24-hour rhythm where it may peak and trough during the day. Very importantly is to maintain an adequate night of sleep. Recommendations are for at least 7 hours per day. I know that it's difficult to get, but again, knowing how much sleep that you need is also very important. So if you know that you're somebody that really needs 9 hours of sleep every day, even though that's very difficult to get, that is often going to be much more helpful in regulating your hormone levels than anything else. So if you think about patients that can lose a little bit of weight, your body's traditionally going to secrete the same amount of testosterone throughout the day, but if you are losing weight and losing it in the way that you're maintaining an active lifestyle and a healthy diet, your body's using that testosterone and it's calling for more testosterone as well through some of your activity. Zinc supplementation is important as well. It is seen in almost any patient that's deficient in testosterone that they are also deficient in zinc, so I would recommend a multivitamin that is fortified with zinc. The good news is most vitamins out there that are of good quality already contain zinc. Let's see, so.
Would you need
Yes.
a blood test to find out if you're deficient in zinc?
Yes, you can. Yep. And then, again, curbing some of the sugars or simple carbohydrates are an effective way to maintain our weight and wellness and prevent buildup of extra fat and allow our body to use its own hormones more effectively. And again, I already know I touched on exercise, but exercise without all of its health benefits does provide a jump or an improvement in patient mood as well. I don't know about you guys, but I usually feel very accomplished whenever I get done with an exercise at the gym, and any day that I can't get there, I just don't feel the same for the rest of the day. So I think a lot of people can relate to that as well. And patients that exercise often throughout the week, if that is part of your daily routine, it can also really help with your sleep, as your sleep time is really when your body will repair a lot of its broken down muscles or replace a lot of proteins, whether for muscles or for other metabolic processes. Okay, so I did touch upon a daily multivitamin. So it really should be part of anybody's regimen. It is impossible to get every single vitamin in every single daily recommendation. of a good multivitamin just with your diet alone. So, you know, it doesn't hurt to take something like a vitamin, especially if you can source it with high quality ingredients that don't have fillers. You know, we offer a lot of alternatives to some of the less or lower quality vitamins out there. So not only do you know that it doesn't have the kind of fillers, but it may also aid in absorption. Vitamins are important because the time that you take a vitamin is important, because a lot of vitamins require an acidic stomach to be able to absorb those ingredients. So patients that are using certain medications that raise your stomach pH, such as Prilosec or Nexium, this may impact or impair your ability to absorb these vitamins, but I would still absolutely recommend taking a vitamin if you're using one of those types of medications.
When is the best time to take a vitamin?
I would say in the morning, with breakfast, yeah. You know, if you take it, say you take a capsule or a tablet or powder as well, and then, you know, you follow that with a meal. So that would be an excellent time to take it. Because, you know, it is an acidic environment that your stomach actually will raise, you know, the pH will raise in your stomach when you take in food, but at the same time, your stomach is pumping in acid to be able to break down that food. So it's an excellent time to take a vitamin. Yes?
Do we need extra vitamin D or E seasonally, like with the short days we have?
I would absolutely recommend taking vitamin D and vitamin C, or did you mean calcium, or?
I meant vitamin C and E, and I thought calcium had helped us to absorb them, but I don't know.
So vitamin D aids in the absorption of calcium, which
Okay.
is essential for bone growth, and vitamin C is very effective for your immune system in aiding your immune function. So extra supplementation wouldn't hurt in most cases, but you're absolutely right. Most of the natural vitamin D we get is from the sun, so this time of year people are not outside as much. I mean, I know I'm not working on my yard right now, and and when I snow blow, it's at 5 a.m. So, but it's absolutely important to take it, and it wouldn't hurt to take a little bit more in the winter.
My wife's a diabetic, and I
Okay.
give her medication for type 2 diabetes.
Okay.
I didn't know if that was one of the medications you were talking about that impacts the absorption of these things.
Let's see. So those options that I specified for like Prilosec or
Yeah.
Nexium, those are for people that have heartburn traditionally.
Okay.
So
Like omeprazole?
Yep.
That's one of the things she takes, does that impact, should I give her vitamins at a different time of day?
I would definitely have her take it in the morning. Omeprazole is difficult because that type of medication is almost permanently raises her stomach pH.
Okay.
But I would recommend trying to take it in the morning as well,
Okay.
if possible. Okay.
So those drugs don't impact necessarily the vitamins?
They impact the ability for our body to absorb the vitamins. But so if she's on something like that, she might benefit from supplementing with a vitamin twice a day instead of once a day.
Okay.
So that would be my recommendation, because it's harder for her body to absorb what she's
Right.
taking in. You have a
Okay.
question?
Yeah, so if you're not you're not taking any medication and you're taking a food-based vitamin like an 8 or something, or
Yeah.
Mega Foods, and they say it can be taken with or without food, but you still would recommend taking it with food or right after,
I would recommend taking it right before.
before,
Yeah,
okay,
right before.
all right.
Okay. Excellent. And I just want to touch upon certain vitamins are available as a methylated option. So methylated items like methylcobalamin is vitamin B12, but there's also cyanocobalamin. That's the most commonly available B12 is the cyano, but the methylcobalamin is actually better absorbed as it's activated. So an option like that might be more helpful for you and in aiding in absorption as well. So If you do read the fine print in your vitamins, you can look at and see if any of these items are methylated to see if they're going to help you. And there are certain patients out there that do have genetic defects. They're not able to, their bodies aren't able to methylate certain molecules, so they have absorption problems of their own. So they will, that kind of patient will want to take a methylated vitamin as well, or as many methylated ones as possible. Okay. So next, I just want to touch upon, an adequate amino acid intake. Our recommended amount of protein that we want to take is between 0.5 gram and 1 gram per kilogram of body weight. So say if you weigh 50 kilograms, or about 120 pounds, you'd want to take somewhere in the vicinity of 25 to 50 grams of protein per day. And of course, getting that from food sources is better than getting it from supplement sources. If you are taking, patients will often get their protein from meats as well as seeds and fish. And other than that, there are supplements available for patients that want specific proteins or amino acids that they want to use. And again, they're responsible for the buildup of muscle as well as the maintenance of all of our body's cells. But chiefly you can think of it as muscle building protein, because again, as we exercise, our body breaks down older cells and makes new ones. Newer and stronger is one way you can think of it.
Kevin?
Yes.
How do anabolic steroids work?
So to be honest with you, the aid in steroids is to aid in muscle growth and production. But again, as we discussed about increasing the size of your heart, the risk of anabolic steroids is that they're not just gonna, if I take a steroid shot, it's not just gonna go to my biceps, it's gonna go everywhere. And the risk there is if I don't need testosterone supplementation, my body's just gonna use it wherever it wants to. And for the most part, it will go everywhere if you don't have a specific, if you're not if you don't have a specific decline. So that's where you see for people like baseball players or football players or any kind of athlete that use those kinds of steroids, that's where they do increase their risk of having a heart attack down the road, because when using those steroids, they go to all the muscles of the body. And unfortunately, the biggest risk is increasing the size of the heart as well.
Is it always injected? Is that how they're administered?
It's traditionally injected. Yep. Is that, well, talk about the best absorption. If you put something right into a muscle or right into the bloodstream, it bypasses any of our body's natural filtering process. So anytime you take a tablet by mouth, it goes to the liver first, and the liver will filter out X percentage of the active drug before it gets to the bloodstream. But if you take something IV or IM right into the muscle, you have what's considered 100% bioavailability. So that's where you see a lot of hormones are taken that way. And number two, because hormones are often complex and fragile molecules, if you were to take a capsule of hormones, it's very probable that it would break down in the stomach. So our body's digestive system can easily break down something like insulin, and that's why we can't take insulin hormone in a capsule. That's why it has to be injected. This is too fragile. But I just wanted to highlight two specific amino acids that are helpful in aiding blood flow in men and women as well, but to impact performance. So citrulline is a precursor to the molecule arginine, and the benefit of arginine for patients is that it's a precursor to a molecule called nitric oxide. When nitric oxide is present in our blood vessels, it will cause smooth muscle relaxation. The relaxation of the muscles surrounding our blood vessels will lead to vasodilation, or those blood vessels can open up. Yes.
So as you get older, does nitric oxide decrease, your body producing it, I mean, like? but
Not
it-
necessarily, so if, are you talking about how when you age your
Well,
blood
like
pressure
like for
increases?
blood pressure, you know, if your blood vessels or arteries are not expanding or whatever, I don't know.
So I don't know of anybody that has ever had a deficiency of nitric oxide.
Okay.
I think as you age, you have more going against you or more to fight against in terms of maintaining your blood pressure. And I
Okay.
think that's why you see it's easier to have an increased blood pressure as you age.
Okay, that's okay.
So I do want to highlight a few natural products as well that could aid in performance and blood flow depending on the type of product. So there is an extract called yohimbine. It is taken from the bark of the yohimbe tree, and it is an aphrodisiac that is also helpful in increasing blood flow as it will block alpha receptors. And when an alpha receptor in the blood is blocked, will also create vasodilation or increased size of the blood vessel to allow more blood to go in to the area that it's looking to go. It's dosed, there's a wide variation in the dose, and there is a big difference whether you take the refined yohimbine or if you take an extract of the yohimbe tree. So on the prescription side, we do make yohimbine for patients based on a doctor's prescription, but on the over-the-counter side, we do carry the bark extract as well. So milky oats is another option available. This medication, or this extract is taken and it's been seen to regulate or balance hormone levels for patients, and it does strengthen the endocrine system. As I said, testosterone is a hormone like any other hormone out there, insulin, estrogen, progesterone. It just has its own specific traits and jobs the way that other hormones do. And we do offer it in an alcohol-based extract, and it's taken under the tongue. And again, it is also an aphrodisiac and has been carried through history from ancient times when it was used as a love potion. Horny goatweed. I actually want to ask Gary if he can elaborate on this. He had a good story about horny goatweed.
That's one of the few plants or herbs that they kept the name. What a bunch of shepherds of goats saw that when the goats ate that plant, they got very randy. So of course, the herders are up in the mountains all the time. So when they're heading back, they figured, hey, if it's good for the goats, I'll try it. And they started eating it, and it worked. And they never changed the name. So horny goatweed, it's, I guess it's to help make horny people too. So it seems to be very effective.
So another aphrodisiac option out there, but again, just like the arginine, we've seen that it can increase nitric oxide levels in the blood vessels to aid in smooth muscle relaxation, and again, hopefully impact performance depending on the patient. So another natural product that we have available is called maca root. It is also, like Gary said, found in mountainous regions in South America. Something about those mountainous plants, I guess. But again, some of the effects are a little unique compared to a few others that I just touched on. So it's been seen to increase our sperm count, which in effect would, you would think would increase our fertility. And as well has had a benefit in prostate size. So the smaller your prostate can be, the more performance you may be able to have, as prostate on the, in the tissue of the male reproductive system can be inhibitory if it is grown in size. Let's see, so another item out there is Asian ginseng. So something like this has been shown to be effective in improving stamina as well as ability, not just athletically, but performance for people with their partner as well. Let's see, are there any questions? Okay, so one other option, this item is specifically unique for patients that have BPH would be saw palmetto. So it is an extract as well, but has been seen to improve not just prostate size, but in effect would then improve urinary flow rate. So this is a very common option, probably one of the most common options that I recommend for patients. Not only because I speak to male patients the most, but just has a lot of evidence that has shown that it has been helpful for patients that don't necessarily want to go right to a prescription or go right to that prostate surgery to have an impact on their BPH. But of course, if there are certain reasons or certain patients out there that need prescription options, there are a lot of options available as well to alleviate some of your symptoms or concerns. So number one that we see in patients is after they have their testosterone level measured by a doctor, if they are shown to be deficient in testosterone, as well as showing some of those signs of decreased testosterone, such as fatigue, lack of interest, lack of libido, bone density issues, that patient may be a good candidate for testosterone supplementation. Now, there are a lot of dosage forms available. The most common option is for patients to use it as an injectable option for a number of reasons. Number one, they traditionally don't have to use it every day. It's commonly given as an injection once or twice a week, or maybe even less common depending on the patient. There is oral testosterone therapy. We actually use a methylated version of testosterone called methyl testosterone, so that can help aid in absorption for patients. But again, it is an oral therapy that they would have to take every day depending on their case. Another common option, patients will use transdermal testosterone therapy. They will use a cream and they'll apply it traditionally once or twice a day depending on the patient. We have the ability to make a much higher strength cream than what's commercially available. So depending on your case, one of the higher strength androgel products is only 1.62%. But if you're a patient that needs a lot of testosterone supplementation, and maybe you need a 10 or 20% cream to get an adequate amount of testosterone, then that's something that you can discuss with your provider. And some people don't want to slather a whole handful of cream on every day. So it depends on everybody's situation. But another common option that we see with patients is implantable testosterone therapy. Now, it's a very small, they're known as testosterone pellets, so they're very small cylinders of essentially pure testosterone that your doctor would implant into just under the skin. And it's probably about the thickness of this paper clip, so depending on your dose. And it might be maybe about, up to ½ an inch long, depending on how much supplementation you require. Likely much smaller than that. So again, depending on your doctor's comfort level with that, that's usually something that a patient will get in the office as an implantable therapy. And again, the effects of this therapy are to improve their energy levels and sex drive. And just something to look out for is that any of the supplementation is subject to your body's own feedback mechanisms. So if your body realizes that you're supplementing with testosterone, the body might think, oh, I don't need to make any testosterone anymore. So, depending on your case, you might see your testosterone levels drop if your body realizes or doesn't think it has to make any more of this anymore. So it is important to be under the supervision of a prescriber that is measuring your levels if you choose to be on this sort of therapy, because you do need to get measured often every 3 to 6 months to see where you are from baseline. Yes?
Does the testosterone have to be balanced with the estrogen and other hormones in the body? Doesn't there have to be a balance? Not just
Absolutely.
plain testosterone?
Absolutely, so it depends on the patient. Most male patients find themselves deficient in testosterone specifically. There are patients out there that are deficient in other estrogens or progesterone as well. I'm touching specifically on testosterone because that is the most common, that's the most common way that male patients present, is that they're just deficient in testosterone. But you're absolutely right, they can be deficient in other hormones as well.
So they have to be tested,
Correct.
yeah, by the doctor?
Yep. So again, and again, you look at your level measurements along with your signs and symptoms to assess where you are. If your levels are at 400, but the optimal level is 800, but you're in excellent shape and you don't have any fatigue or you have excellent libido, then you might be just fine because you're still within, the quote unquote normal range. So everybody's their own unique case.
But your supplements are not, of course, as strong as an injectable testosterone, so it aids and it won't interfere or it won't counterbalance the other hormones.
So if your other hormone levels, if you're a man or a woman, if your other hormones are adequate, it may be, it may be the best choice to just use one hormone at this point, just the one that you're deficient in. So again, it depends on everybody's case. Okay. Yes,
I also run, I also hike a lot.
okay,
Hiking is, certainly around here, is challenging, especially up in New Hampshire. I can hike for 7 or 8, sometimes 9 hours, so
Okay.
boy, I get pretty exhausted.
Yeah.
What do you think of these high energy drinks that are they mainly just caffeine, give you a quick boost of energy and then eventually?
so a lot of them will have caffeine, a lot of them have a lot of sugar as well, and there are certain items in there as well, like taurine, or if you look at a lot of the very small ones, they'll have a high dose of vitamin B12 as well. So I think they're a great option. If you know that something like that is effective for you, then that's excellent. I mean, I personally do drink a lot of caffeine every day, so I think caffeine is very helpful.
Yeah, no, I agree, I think let's do it.
Absolutely.
Starbucks is so popular. and
Yes.
profitable.
It is a drug as well, caffeine, so.
Right.
Yes.
Is fish oil or flax oil good for the prostate, or not really related?
I don't know, maybe Gary, you have a thought on
The
this?
fish oil is high in omega-3. Omega-3 is the body uses as an anti-inflammatory. So whether you say that's direct or indirect, it can be very helpful, especially as we get more mature, because our prostates do get a little inflamed. Fish oil isn't the first thing to use for an inflamed prostate, but it should be part of the treatment or of the protocol. That answer it?
Yeah, thank you.
You're welcome.
But on a cholesterol level, on a note for cholesterol, when you're using healthy fats like omega-3s, at the same time as you're eliminating or decreasing bad fats such as saturated fats or trans fats, that's going to have a benefit to your testosterone, to your cholesterol and triglyceride levels as well, on average. So, absolutely, supplementing with that as well as trying to get rid of the bad fat is an excellent option for anyone. So I just want to touch upon, so that is, as I said, is an excellent option for cholesterol, and statin therapy is the prime drug therapy for patients that may have atherosclerosis because of cholesterol buildup. So patients that use certain items like atorvastatin or rosuvastatin, or other statins out there, but those are the best two. So patients that do need those kinds of medications, when using that kind of medication for long term, have shown that they decrease their LDL or their bad fat, and at the same time have had the ability to increase their HDL or their good cholesterol as well. For certain patients that are not responding well to therapy, or patients that have any sort of cardiac emergency, patients that need stenting therapy in at least one part of their blood vasculature can have, something like this can have an excellent benefit for you. So, anybody know what stenting therapy is? Okay, so this is an example of an atherosclerotic blood vessel. It's looked at as a portion of a blood vessel surrounding the heart. So that blood vessel feeds the heart with oxygenated blood. So it's among the most important blood vessels in our body, because if the blood can't have enough oxygen, then it's not going to work, and then you know what happens after that. So what doctors will often do in patients that have specific issues or abnormalities in these blood vessels is they will go in with a catheter right into the blood vessel, and they inflate a balloon in the catheter, and what happens is that a wire mesh will stay in that blood vessel traditionally for life, and what that will do is that will normalize the size of the blood vessel and prevent blood flow issues from occurring there, at least as long as the patient is able to keep up with their therapy. And again, patients that have diabetes have a lot of opportunity to improve their condition. Number one, if you are a type 1 patient, you unfortunately do have to remain on insulin therapy for life, but you can use a lot of tools such as diet and exercise modification to optimize your condition. Patients that have type 1 diabetes are still looking to keep their blood glucose A1C under 7, and with adequate insulin therapy and with the right kind of diet, they can prevent spikes and troughs in their blood glucose and keep their numbers as good as possible. For patients with type 2 diabetes, there's a drug called metformin, which is the standard for any patient that has type 2 diabetes. It's the first drug anybody should be put on. It does cause some difficult GI side effects, but we do see with patients that they will improve with longer term treatment. But the most important element of metformin is that it is working in our body's liver, and it's trying to prevent the creation of blood glucose, or it's trying to prevent the absorption of that glucose from getting into the bloodstream. So not only is it the most effective therapy we have in maintaining or lowering glucose levels, but while it's preventing absorption into the bloodstream, it can actually be weight beneficial for patients as well. And there's not a lot of drugs out there that are weight neutral or help patients lose weight. And again, on the diet and exercise side, with people that have diabetes, changing your diet to try and stay away from carbohydrates is the best way to improve your condition, because fat and protein have little effect on our insulin and blood glucose levels, whereas it's frequent use of carbohydrates that cause the rise and crash in our blood glucose and insulin levels that you often see with diabetic patients. Let's see, so again, I touched upon this at the beginning, but patients that have depression with sexual dysfunction may aid in their condition by making a change to their therapy. This is important to talk to your provider and see if your provider's on board, as well as discussing if sexual activity is safe for you. Another option that's available that does have to be customized for patients as well is oxytocin, which is known as the love drug for people at Johnson's. It's something that we make for patients that when given under the tongue, it gets absorbed right to the bloodstream. They often do see increased libido as well as happiness and well-being. And for male patients specifically, patients will use this type of item to actually help them achieve an orgasm with their partner.
What's the dosage?
It's dosed in units, traditionally between 24 and 96 units of the hormone, but usually taken under the tongue before activity. Yes.
Sorry, a delayed thought on the blood glucose. Is
Uh-huh.
it dangerous for someone who's like diabetic or has high blood glucose levels to kind of quit carbs cold turkey? Is it something that they need to kind of wean down off of, or, and how long does it take, like, for your system to kind of make that adjustment?
So there's actually a TED Talk. If anybody's familiar with TED Talks, there's a TED Talk about diabetic patients and bariatric patients quitting carbohydrates. Period. Number one, you do have to monitor your blood glucose very often. And that being said, patients that go on a ketogenic diet that is comprised of roughly 70% fat and 30% or 20% protein and maybe 10% carbs, but doctors that believe in this diet try to aim for 0 if possible. But that kind of diet has actually been shown to maintain blood glucose levels more effectively than the traditional treatment. The traditional diabetes treatment is all about a sliding scale, so to speak. You measure your glucose, and if it's elevated, you give yourself insulin, but when you give yourself insulin, you lower your glucose, and sometimes to an extent that you have to eat more carbs, which then will raise it, and that's why it's such a dangerous roller coaster that a lot of patients can be on. And I've seen from few patients that this kind of option has been very effective, not only in maintaining their weight and helping them be healthier, but also by ridding them of diabetes, so to speak, as well. So just some non-specific treatments as well. So the first line treatment for patients that have erectile dysfunction traditionally get put on an oral agent. So a PDE5 inhibitor, also known as phosphodiesterase 5, is a medication like Viagra or Cialis or Levitra. The medication is taken to relax vascular smooth muscle is the end result. And what happens is when that relaxation happens, it will aid in some men being able to produce an erection. There are a number of drawbacks to this therapy, though, as it will decrease blood flow in the entire body rather than just in the one area you're looking to decrease in that sense. And it's also very important for patients using this type of medication, if they're on any sort of nitrate therapy for angina, that it is contraindicated to be on one of these types of medications. And nitrate, like nitroglycerin, for patients that take tablets under the tongue as needed for chest pain. And another option that I just want to highlight is for patients that, like you said, for patients that might have hormone imbalances, not just testosterone. So something like an anastrozole will actually block our body's breakdown from testosterone to estrogen. So certain doctors will provide this type of medication for their patients if they want to try and use a backdoor treatment to maintain or elevate their patient's testosterone levels. What we see with a lot of patients is because the PDE5 inhibitor therapy is not a one-size-fits-all therapy for patients, as it's not a targeted therapy, we see a lot of patients will eventually graduate to requiring injection therapy to perform and maintain the kind of erection that they want to. And what we have are a number of available options. So the first option that we have for a lot of patients is called alprostadil. It's a prostaglandin that actually would exist in our bodies already, and when injected directly into the penis, this kind of medication will actually create inflammation and help men create and maintain an erection for the amount of time that they're looking for. Another option for patients, because this drug does have some side effects, some pain and burning sensation. Those are known side effects of the medication. patients that want to try to avoid those side effects may require or want to try what we call the bimix therapy. It incorporates two drugs, phentolamine and piperine, and these drugs are both vasodilators as well. So they increase the size of the blood vessels just in the penis, because that's where they're injected into. And that's the aim as well, because we don't want the medication to go to the rest of the body. And that helps, again, helps men to create and maintain an erection. And the benefit of these drugs out there is that they're, not only are they targeted, but they're very short acting as well. So I talk to men about, you know, trying to have a goal time frame of an hour of effectiveness, because that is a time frame that works with most patients. But this kind of therapy does carry the same risk as the Viagra and Cialis medications, that you do want to monitor that you're using that the medication's not lasting for 4 or more hours, because that can create some vascular damage to you in the long run. And let's say, so if patients try one of the first two options, the alprazolam or the bimix alone, and this medication's still not as effective for them, we see a lot of patients will go to the trimix therapy, which incorporates all 3 of the medications. We see patients do seem to be very satisfied with this kind of medication option, and there are a few patients that will have to add a 4th drug to their mix, but again, I question the effectiveness of adding any more after these first 3. Again, these are highly effective because they're very targeted and they're customized based on your doctor's wishes. There is also much training required. Men have to give self-injections with this kind of therapy, but it is similar to riding a bike, and once patients have the hang of it, it's something that they do have a lot of benefit from using. These medications are especially helpful for patients that have had prostate removal surgery, as almost no matter what you do after you have your prostate removed, it is very difficult to obtain and maintain an erection. And just conclusions, I just want everybody to know it's so important to maintain your passions throughout life, whether it's on your own or whether you are sharing your life with a partner. And, you know, this part of our lives is, you know, just one part, and there's so much more to us as well. But again, you know, your overall health and wellness can be impacted the most from any kind of lifestyle modifications and maintaining a healthy and good quality lifestyle. And again, making some of these lifestyle modifications is likely going to go much further down the road than trying to take the miracle pill, for example. And again, for patients that are doing what they can and still may need a little bit of help, you know, there are natural and homeopathic items available for patients, as well as items on the prescription side to aid in performance. And that's it. Does anybody have any questions? Yes.
Just wondering, nowadays you hear a lot about ED,
Yes.
but you never hear about impotence. And I'm just wondering, what's the difference, or do you become impotent eventually, or?
So somebody
What is
that's
that?
unable to produce offspring, you're saying, or?
Well, that's what I'm wondering, I mean, if
So that's highly related to, you know, testosterone levels, which would, you know, relate to male sperm count. So, you know, testosterone is required to create sperm, so, you know, those are definitely connected, in my
So
opinion.
impotence is really just a lack of the sperm, or ability to perform.
Lack
the
of
sperm.
ability
But you
to produce offspring.
performing sexually is not,
No, not
I mean,
necessarily.
it's not involved in impotence then.
Correct. And for some men out there, they might prefer to be impotent and able to
Yeah.
perform.
Yeah.
So-
I get into discussions with a lot of men, and
Yeah.
it seems like there's a gray area between ED and impotence, and nobody wants to call themselves impotent, but ED seems to be like you're just about there, you know?
Yeah, I mean, I mean, in general, I mean, there are a lot of options out there for people to be able to produce offspring now. I mean, I know IVF has been, you know, a godsend to a lot of couples out there, but, so unfortunately, you know, they might not be able to produce offspring the same way that they like to, or the way that most people do, but, you know, there are still options down the road. You know, the average sperm count for men could be decreased, but if you know, are able to, you know, go through IVF therapy, you know, you can have somebody that can, again, give you, like, improve your odds by giving you, you know, a more targeted approach. Yes?
Oh, well, I guess there's so much talk about this. The thing is, what are the causes, you know, that cause all these problems of BPH? And, you know, what I found is that you can take care of the whole thing by detoxing. And so I think that's what you gotta do, because what happens is you get pesticides and herbicides, you get bacteria, you know, in the system. That causes the inflammation. So if you can take care of the inflammation, you know, you don't have a problem.
Absolutely. And, you know, as Gary said earlier about BPH, that, you know, a lot of it comes from, you know, the things that we eat as well, and not just the things that we breathe in, so.
Right, it'll go right to the prostate.
Yeah.
Especially mercury.
Yeah, absolutely.
Yeah, so you gotta get rid of the mercury in the system. Yeah.
Also, stress is a big thing too,
Stress is
because,
all- yeah, but the exercise gets rid of the stress.
yep,
Yeah. So that's
Isn't it
one
age too?
component is.
It's all related, it really is.
That's right.
Yes.
Is testosterone actually initially produced in the gut?
So it's produced in the testicles.
I thought I read somebody that actually starts in the gut and then eventually winds up there. So I'm wondering, is there a correlation between your gut health to produce testosterone? And as you're getting older, obviously your gut health is going to deteriorate after suffering. And also, maybe, I don't know if anyone's ever done a study to relate the two, the gut health versus testosterone production.
Unfortunately, I don't know of any studies, Steve.
I don't know about studies, but it makes sense,
It
because
does,
if the
yeah.
gut health is going down, the nutrient absorption is down.
And that would explain why
Yeah.
a younger person that shouldn't
Well,
is happening to him.
right, but also the other side, if you talk to people who are retired down south in their 70s or 80s, they say it takes a lot longer, but they're having sex more often than they did in their 40s or 50s. And part of it is, if you're retired and you became a snowbird, you're financially successful, the family is still up here, nobody's walking in on you, you're working because you want to work or you're not working, and stress is gone, so you're out of fight or flight, and the blood is going to the digestion and to the reproductive organs. You know, the problem is arthritis and all that, so it takes a little longer to get the clothes off and everything else. But, you know, there are people who are in their 70s, 80s, into the 90s that are very sexually active. And a lot of the problems, I think, you know, as Kevin was saying, are self-inflicted, not on purpose, but by not taking care of ourselves over the decades. And eventually the machinery starts breaking down.
That's what I'm wondering, like, obviously the digestive flora is gonna break down as you get older.
But
So-
but if you take care of it, you can have a good digestive
Well, yeah, that's what
system
I'm
your
getting
whole
at.
life.
So maybe you can
Yeah.
approach it in that respect.
Yeah, yeah.
Yes.
So he mentioned detox, so what does he mean by detox? I mean, what's the? I mean,
So
just
therapy is
going
to flush out
So just
toxins from the body. So there are certain programs you can go through, like chelation therapy, to take out toxins from your body. Of course, taking in an adequate amount of antioxidants by, you know, eating natural foods is also going to be an excellent option for you to naturally try and get rid of toxins in the body. So fruits and vegetables are an excellent, you know, choice to naturally try and get rid of some of the oxidizing items in our body.
And adding the cruciferous vegetables, they're very good at supporting phase 1, phase 2 detoxing in the liver. And most of us stop eating the cruciferous vegetables because they're not fun. You know, they're delicious. So, you know, we go back to diet again, and exercise and lifestyle. And there's a lot of herbs and homeopathic products that can help the body detox instead of forcing a detox. So for the most part, if you can figure out the right formulation to help the body, you're letting your body clean up the mess at the speed it can do it instead of forcing it, which can sometimes cause some serious problems.
Can a stick be put into either an artery or a vein? And what keeps it in place once it's installed?
So pressure, it's expanding.
Just friction, basically?
Mhm.
Can you use
It could be stitched in if necessary.
Oh, I understand.
Yeah. Could be put in a vein if necessary, but
Either
it's
one.
mostly done in an artery. So veins have valves to prevent venous backflow. So say on your leg, you need, your veins don't necessarily have enough pressure to keep pushing the blood up. So they actually have valves that shut off. So, that shut off the blood so it doesn't go backwards. So you see it most commonly in arteries because there's not as much complication. And frankly, they're more important in your arteries.
And thank you, Kevin. Kevin will be upstairs to answer questions, we'll all be up there. And Kevin put out some products, you can look at the different formulas. This is probably the #1 go-to for soft palmetto, but it's a blend, it has other things in it, usually with the herbs. A blend, just like cooking, the seasoning, all helps together. He had mentioned the maca. Sometimes there's the opposite problem. This is very, very effective to desensitize in case things are happening a little too fast. Promescent is good. Any of you use a Pure Remedy product? They're great for different conditions. There's a female moisturizer, which is great because women have issues too. What's interesting is one of the herbs in here it's from a fir tree, causes dilation and increased blood flow. So the man can apply this, it helps the woman, increases blood flow on him, and everybody's happy. And so there's all different things. If you have any questions on anything, just grab one of us and we'll be glad to discuss it. And thank you, and remember, everything in the store, not just the stuff Kevin talked about, 20% off as a thank you. And thank you.
Thank you.
Well,
Yeah. Okay. Yeah, it could be. Did you notice?
Yeah, let it go.
Yeah.
I don't take prisoners, you know that.
Yeah. So I'm a marathon runner. Would never be able to do anything like that after running a marathon. So.
Let it go, what happens, happens.
Take care. Thanks for coming. Hi, how you doing? Okay. Yeah. There's a moisturizer.
And when you go upstairs, there's a couple of others too. Very, very effective.
That is.
Well, that one is good, it also increases blood flow, and so it can be warming. That can either be helpful or not, depending on the person. Why don't we go upstairs and I'll show you a couple of things.
Hi, here you go. Yep.
Let me just turn this off, so if somebody says something.
My wife went through menopause, I mean, she's still